please end depression now.
End depression.
End depression.
End depression.
End depression.
End depression.
Dr. Nkporbu Kennedy. I'm a consultant neuropsychiatrist working with the University of Port Harcourt Teaching Hospital, and also a senior lecturer with the College of Health Sciences, University of Port Harcourt. I major in psychiatry in the aspect of substance abuse. Depression is basically a mood disorder that is characterized by sustained alteration in mood with other symptoms which may range from loss of appetite, loss of interest, reduced energy, feelings of guilt, weepy spells, and some may even be so bad to end contemplating suicide. The causes of depression are multifactorial. We have biological causes, environmental causes, as well as psychological and social causes. Now, the biological causes are the ones that have to do with the body system, like genetics, substance abuse, medical illnesses, medication. These are all biological causes. Special substances in the body called neurotransmitters. They constitute the biological causes. Now, the social and environmental causes are events that happen in our day-to-day life that have to do with our relationship with others or things that happen to us. They include losses, relationship losses, business losses, bond properties, bond house, interview losses, school exam failures. Then others will be marital difficulties, divorce, separations, prolonged marital difficulty, that's difficult marital relationship, will also cause depression. Others may also include loss of job, or one has finished school for a long time and you don't have a job. They are all environmental factors that will cause a depression. Quarrels, family quarrels, individual family ties, difficulties, they are all environmental factors and social factors that could cause. Then the cause social factors could include like armed robbery, attacks, kidnapping that is very common now, or people come to your house, loot properties. They are all social factors. Rape, both to the females or the males, are all environmental and social factors. Now, the psychological factors will include some psychological illnesses, but mind you, all the biological and even the environmental can even cause the psychological causes that will even fuel depression, like feeling bad, anxiety, other psychological, emotional problems will also sum up to cause depression. Personality traits. Some people have depressive personality, as in they are anxious, that is their nature. A little thing happens, they are tuned towards depression, tuned towards being anxious. That is their personality. We call them anxious depressive personality. They are also prone to having depression. So in summary, these are all possible causes of depression. Yeah, actually, unarguably, depression is most prevalent now among young people with resultant suicidal consequences that is almost all around. So the things that are fueling this among the young people are basically what has to do with their age problems. Unemployment, the level of unemployment is very high among the youths these days, and this conforms to one of the types of suicide that Amy Duncan talked about. That is the anomie, when one's expectation in the society seems not to be coming true. So you see a lot of young ones coming out of school, they don't have job. So, and also the result, what is resulting a lot of them turning into taking other options or vices that are not conforming to the ideas of the society, like taking up arms and robbery, becoming thugs, to probably politicians, and some of them getting into kidnapping. It's all about to be able to sustain themselves. They don't mind taking into activities that are criminal in nature just to sustain. This is aftermath of unemployment. So unemployment is on the high side, on the list of what is causing depression among the youths. For those of them who cannot even take up this, and you see them rapidly deteriorating into depression, even if they end up taking to these vices, it doesn't stop them from getting depressed. It's when you see them, because some of them kill, and of course at a point they may be remorseful. Now, aside the unemployment, the next other thing causing this high rise of depression among youth is substances of abuse. And to your surprise, they interwove. For them to engage in these activities, they even need to take these substances. Some take these substances to be able to be bold enough to engage in these vices. They need to be high to be able to take on, to commit crime, to take up arms, to even kill. They need to be high. So they take up this, they take these substances: alcohol, cannabis, cocaine, and tramadol. That's the heroin, the opioid products. Now, some of them who is not because of, is not motivated by crime, are the ones who want to self-medicate themselves because the emotional problems have already set in, and they know that these drugs could give them temporary relief, like sleep. That is also a major component of depression. That's poor sleep. When they take some of these drugs, the alcohol, the sedatives, they are able to sleep, and because these drugs carry addictive property, then they gradually become addictive. So that's the second reason why the youths are getting depressed more. I've mentioned unemployment, job-related problem, and then the second one is these substances of abuse. The third one is all the other consequences of whether crime in the society and substance abuse resulting into other vices, kidnapping, rape. Being victims of all these are other reasons that are causing the young ones to also become depressed. Well, it's not far from what I've earlier said. It's because the rate of depression is increasing. There is now a corresponding rate of contemplating suicide, either deliberate self-harm or complete suicide among the youths. No very certain that depression is the number one cause of suicide, and the other isolated causes of suicide, even the substance abuse I've spoken about, can on its own cause suicide. But most of the time they are linked to depression, because before somebody will start using substances, they may also have become depressed. So depression is the leading cause of suicide, is the number one cause of suicide. So because depression is rising among youths, so also the rate of suicides are also rising. And it's because they are caused by the same factor. When somebody could no longer come to terms with the reality of the society. Now match this with the person's yearnings and expectations in life. They are not corresponding at all. So the best thinking is for the person to take his own life. Now, having said it, it's also important to point out that it's not as if suicide had not been around us. What is really making it so pronounced now is because the way society viewed society in the past, that seeing it as a taboo is gradually weaning off. As in, people don't reckon with that. In the past, it's before somebody will commit suicide, you think of all the stigmatization that come with it. In those days, people, when a family member commits suicide, it's almost an everlasting dent on that family. Many people will not want to have any association with that family, even come to marry or interact or associate. But these days, that taboo is like completely wearing off. And as a matter of fact, most of the deaths that were seen that were happening before, don't be surprised, most of them were suicide because the families will concede it. They will not even let other people know, even when they know that the person kills himself. But now, because the society no longer sees suicide as if it's the most obvious crime, people now are free to even say it, publicize it, because people don't longer see it as crime. And it's important to also point out a study has been shown that giving so much publicity to suicide is also a motivating factor for other people to commit suicide. So we should strike a balance between reporting crime and giving it so much publicity.
Hi, I'm Dr. Yusucho Greg. You're tuned in to Right Minds TV. I'm here to speak out that you end depression now. It always eases when you talk to someone about it. Talk to a friend, talk to a neighbor, talk to someone you know that cares about you. Hashtag end depression now. Hashtag speak out. Hashtag stop suicide. God bless you. Stay tuned to Right Mind TV.
This is Kingsley Idia. You are on to Right Mind TV. End depression, end suicide. You don't need to commit suicide. Keep on watching Right Mind TV. You are on the right track.
There is always a good side to any situation. You are worth more than that challenge. Do not give in to depression. Suicide must never be an option. End suicide. End depression. My name is Pharmacist Joseph Ibirim. Keep watching Right Minds TV.
Hello, my name is Paul Nima, CEO of Dream Visual World, right here at Right Minds TV. Share your pain and depression. Peace out.
Drop it.
Depression affects all age group, all class of people. It affects all class of people, although for class-wise, it's more common among the socio-economically deprived people. Now for age, even though it affects almost all age group, it's been said that the depression is common among the age of 18 to 45. And if you see this, take this age group, this is basically the middle age group, the youth, 18 to 45. So it's in line with what we are discussing. But having said that, everybody, the young and the elderly, could also be depressed. The rich and the poor could also be depressed. Depression, basically, as I defined, is a mood disorder. So the most prominent or obvious things you will see is that the person's mood will be depressed. The person will be on the low side. This person's spirit will be on the downward side. When you look at the person's affect, it will not be as bright as it used to be. Everything will be turning inward. The mouth angle turning inward. You see creases on the face, all pointing out to a moody face as against a cheerful, bright face. So that's what we describe as mood. Now, that's the affect you see as an individual or a doctor. Now, if you ask the individual how are you feeling? The most 80% of them who are depressed will tell you that I'm not happy, I'm not feeling fine at all. So that will describe that as their mood. That is the mood. Other symptoms are there is loss of interest in previously pleasurable activities. That's activities they will find pleasurable when they engage in watching television, cooking, going out, see friends, going to football, going to choir practice, going to church, visiting, reading newspapers, going to market, and so forth and so on. These are activities that have before now been pleasurable when they do. But you see this person losing interest completely in these activities. Other ones will be there is reduced energy. The person suddenly becomes weak when he or she may not have done any activity that should warrant that level of weakness. The other symptoms of depression could be poor sleep, that's insomnia, loss of appetite for both sex and food. There's weepy spells. You just stay and start to become moody, ruminate on your problem, and start to shed tears. We call it moody spell, weepy spell. There's feelings of hopelessness, worthlessness, and helplessness. We call it this triad. And let me quickly point out that hopelessness is an important marker that points towards depression. Suicide. If any depressed person expresses hopelessness, the person should be taken, should be followed very, very seriously, because the tendency for that person to end or contemplate on suicide is very high. Then other symptoms could also be loss of poor concentration, loss of memory, feelings of guilt, as in even for offenses that they committed and the ones they did not commit. They could also have all these feelings of guilt. Then the other ones are suicidal ideation from death wish. Death wish is that I wish something should just come and take my life. I wish I should sleep, I should not wake up. Instead of staying alive and suffering all these problems, it's better. That's death wish. It will progress beyond that when somebody will now begin to think, since nothing is coming to take my life, let me do it by myself. At the point you now think of doing it by yourself is what we call suicidal ideation. It's no longer death wish. No longer wishing something to kill you. You are now saying, this thing is no longer coming fast. Let me find a way to make it faster. That is now, it changes from death wish to suicidal ideation. Now, by the moment you continue to think, let me do it by myself, when you now think of a way of doing it and you act on it, we now call it suicide. So these are all symptoms of depression. Now again, depression could be complicated by psychotic features when a depressed person begins to accuse everybody around him or herself. That's the severest, getting to the severest form of suicide. You know that we have the mild, moderate, and severe. When one suicidal ideation have come inside, and then the person begins to have psychotic features, we describe as depression as now severe. So the person can begin to suspect people around, say, you steal my thing, you are planning to kill me. That we call that one paranoid psychosis. So it will now be suicidal ideation with psychotic features. Or the person could also, we call that's paranoid delusion. Or the person could begin to see things that others will think may not be seen. We call that hallucination. So when there is hallucination or delusions accompanying depression, we describe that depression as severe depression with psychotic features. It's a severe form of depression. So when depression has become severe with suicidal ideation or psychotic features, the tendency for suicide to occur is very high. So at that point, you need to be serious with the medical care of that individual. The truth is that it is an illness. It's a psychological illness. So it's amenable, the good thing is amenable to modern medicine. Many people still don't see emotional problems as medical illness. They see it as if it's being controlled or caused by spirit. That's a mistake people are still making, especially in this part of the world. But I thank God that the way it was, the way the ignorance was 10 years ago is no longer the way it is now. A lot of transformations, awareness, improvement have taken place. People are now aware that psychological illnesses are part of health problems, and so they are amenable to modern medical care. So you see a lot of people coming to hospital. So basically, hospital is where you can find solution. Seeing a healthcare professional is where you can find solution. Coming to hospital, reporting yourself whenever you see these feelings I've talked about are the solutions. So when you come there, you may not be jumping to teaching house or tertiary. You can start from even a health center, and that brings to bear that government should train a lot of people who have knowledge in assessing, diagnosing basic psychological, emotional problems, even at the primary healthcare center. It's like that abroad now. We have not developed to this place because of lack of manpower, and that should also tell the government to begin to do a lot. In all these health centers, there are supposed to be at least some, even if not a psychiatrist, a psychologist that will be able to see people who have emotional component to their illness. Remember that even those having malaria, typhoid, hypertension could also, because of that medical illness, have emotional component. When they think of their illness, think of their losses, think of how they will stop going to work, think of the money they would need to use to buy drugs, and which some of them don't have. It will now cause emotional component of the illness. So you have those people should be around. Then where they cannot pick up or treat, and they will be able to refer to secondary care and then to tertiary care. So basically, all we use is drug treatment and counseling. The counseling component of emotional care, emotional treatment is very key, very important. And that's why you see many pastors also playing very important role. And because basically somebody that's having problem, what the person needs is counseling. Is when it has been gone moderate to severe that you will need drug. If mild depression, what the person just needs is counseling. For instance, if it is marital problem, husband and wife are having prolonged difficult to a condition for that has lasted 6 months, 1 year. What they need, if it is still affecting one at the level of mild depression, is counseling. When you provide counseling and then what is one adjusts, the other one adjusts, what was causing the problem is taken care of, you see the person comes out of depression. But when it has gotten to moderate and severe, that may not suffice. You may need to probably take the person to hospital. In addition to counseling, you may need medication. So that is what one needs to do. So there are various levels of treatment that are available when somebody accesses medical care for depression.
Please end depression now.
End depression.
End depression.
End depression.
End depression.
End depression.
Drop it.
Who can be involved in combating almost everybody that has something to do with that individual is important in ameliorating the condition. The families, let's start from the families, very, very important, because you need to show families here now with 4 parents and even husband or wife or children or the distant relations. That is the time you need to show a greater care and greater love for that person. That helps a lot. So family is very, very key. We call that social support. The level of social support is high for any emotional illness. The prognosis, that's the tendency that it will be better or resolve faster, is there. It's very high. So we cannot debate that. Then apart from that, friends, peers are very, very important during the period somebody is having emotional illness, where we are talking about depression. That alone could also bring succor and lift the person out of depressed mood. If the person is in school, the teachers, they are supposed to play any role. Anybody that has anything to do with that person showing love would help that person. In the churches, a lot of role they are supposed to play. Counseling, showing love, advice. Government, I've mentioned before, have their role to play. They should provide basic amenities, social amenities. They should provide security. They should provide job. In fact, we should even be talking about preventive psychiatry, preventing depression, where government should provide security. If security is there and people are not kidnapped here and there, armed robbers don't visit house and steal and kill and rape. When you kill somebody, you enter a house, you kill the husband or kill the wife or kill the daughter. The other person will slump into depression that may even be difficult to cure, because recovering a lost person, is not possible. You understand? So if government provides security, that will be taken care of. That's prevention. That's what we are talking about. If government provides job, you finish school, you enter school, you get job. The thousands and millions of people whose depression are caused by unemployment would not be there. Then youths will not go into kidnapping and all this and all that. And then substances or abuse. They should. This last World No Tobacco Day, I thank God Nigerian government is beginning to wake up. They are beginning to introduce some control to tobacco. They should do that to all the other substances of abuse, cannabis, cocaine. If they do that, provide moderate tax on all these products. The bringing them in will not be that small. So that will increase the cost, reduce the availability, and many youths will not be there. So we should be talking about not just treatment of when depression has taken place, but also talking about of prevention. Now, when all these people come to do all this, you discover that depression can easily be taken. Now, the individual himself also has a lot of role to play. We always tell our clients that 50% of the care could be given by caregivers. Then 50% is from you. For instance, you have to talk to your mind. You have to adjust. You should make reasonable budget. Don't over budget. When those things don't come to play or realization or fruition, you get into depression. So if you are planning, plan moderately. Don't if you have money, don't over borrow money foolishly. When people don't return, you get into depression. If you are going to borrow too, don't borrow money that you know that you don't have capacity to pay back, because the banks, they will come after you. And now, if assuming you use this building as collateral because of nonsense, foolish borrowing or loan that you took, and you assess your capability, you cannot pay. Now, when it is time, they will now evict you and your family from this building. You now go to somebody have been living like this. That will cause depression. So planning well, budgeting well, stopping, running away from taking substances, planning your family. Don't give back to 10 children when you don't have capacity to do that, to train them. These are all the things that could cause depression. So I think the individual should be able to adjust. Even in marriage too, if you are making choice of marriage, make sure you choose somebody that is very compatible with you. Because if you do that, the troubles in marriage that also cause depression will be reduced, will not come. Than when you just marry somebody that next 1 month, two of you are now at par, having problems. It will also cause. So, talking about what the roles of everybody is enormous. The individual has a lot to also do for him or herself. You have to learn to trust people. In fact, that type of personality where you don't trust people, those type of people are always most vulnerable to coming down to emotional problem. It's a marker of absence of mental health. those distrust. So you see somebody trusting almost everybody in his or normal state, trusting almost everybody around him or her. That person is not emotionally stable, is not enjoying mental health. And these are people that normally become vulnerable to the slightest societal distress, problem when things don't go well. In other words, I'm saying that if you have a confiding relationship, people that you can go and relate things to, those people have, that's already what we call a coping mechanism in itself. That's a coping mechanism in itself. Those people, they even when they are bound to have problem, they could recover faster because they could also empty their problem to other people, unlike those who cannot do like that. So that is a good quality everyone should learn. Open up to people. Get people you can't discuss with. Get people you can't disclose your problems with. If you do like that, I think it will go a long way to even helping the depressed person to recover. So in summary, I think it's important for people to know, as I've said, that depression is an emotional problem. It's amenable to treatment, to even modern medicine. And so the stigma, perceived stigma that people normally associate with depression, is high time they got removed, because depression is something that could be cured, something that could be taken care of. And the fear now surrounding depression in recent time is that of suicide. There's no need anyone taking his or her life because things are not going well. You also should have solace in God, because no situation is permanent. That thing that is making the depressed person to take his or her life, you may be surprised if you stay alive the next moment, the next second, the next one day, that thing would have been removed, and then you will live long and live good and live well. Thank you.
All right, thank you very much, sir.
You're welcome.